The lower numbers of infected people and deaths than were previously predicted should not be seen as an indication that our actions were unnecessary, but as a strong indicator that our aggressive and control measures were both necessary and effective. One more time, the lower numbers of infected people and deaths than were predicted should not be seen as an indication that our actions were unnecessary, but rather as a strong indicator that our aggressive control measures were both necessary and effective. And your help and cooperation made that possible. As you just saw, the early models showed the potential for deaths in the tens of thousands if we didn't take immediate and aggressive action. But Nevadans took this seriously, and I'm proud of you. You've been staying home for Nevada. You're wearing face coverings and protecting your families. You are the reason we have avoided thousands of deaths and a breakdown of our healthcare system. You heeded the calls, followed the directives, and saved lives. Yes, you saved lives. The actions we are all taking going forward will determine if we continue with this success or if we take a more obstructive path. A lot of people have been sharing this analogy recently with me, and I think it's appropriate, arguing that flattening the curve and that we can immediately lift restrictions in one fell swoop is like arguing that a parachute has slowed our rate of descent so we can take it off now. We cannot take off the parachute. Experience gleaned from other countries teaches us that we cannot flip a light switch and turn our lives and our economy back on too quickly. We still have a responsibility to protect people and to protect our economy. Even though the models look good for Nevada right now, we are not out of the woods yet. The models change based on our behavior, based on your behavior. We're in a better spot than we were 6 weeks ago, and we've gotten much more data to help us move forward as we work on our plan to reopen the state's economy.